Hello, everybody. This is Eukarya, Dr. Eukarya Wanyaun. I am a general medical oncology practitioner and have been in the field of oncology for over 18 years. 15 of that I worked with MD Anderson Cancer Center. I have also been the president of AIDS Cancer Care Incorporated, which was founded back in 2011. Today, we are going to speak to you about cancer survivorship. Every month, we kind of pick one of the cancers and we discuss it, and we'll post it on our website, which is AIDS Cancer Care Incorporated, and our website is www.aidscancercareinc.org. So if you go to our website, you'll be able to see all the recordings on various cancers and the future ones that we're going to have that has been recorded on YouTube and posted so that everyone is privy to it. Our goal is cancer awareness, cancer prevention, and at ACCI, we strongly believe that awareness and early detection are key to survival from cancer. Now, I don't know if most people are aware of this, but June is actually Cancer Survivor Month. And all these fights and all the efforts we make to educate people and screen them, the goal is to promote survivorship, right? So we at ACCI are very interested in getting people's attention to survivorship. You know, when you are aware that what we do can truly make a difference, then maybe more people will be enthusiastic and be proactive about doing something to ensure they either prevent it or if they detect it early, then they get treatment. Now, having said that, let's go to statistics. Statistics by American Cancer Society and the National Cancer Institute says that as of 2019, an estimated 16.9 million people are cancer survivors within the US. And this is just 5% of the entire population. You know, until we bring this to your attention, you don't stop to think about it. Now, two very vital things when it comes to cancer survivorship. The first one is the stage. Cancer survivorship is dependent on the stage of cancer. An example is, let's take small cell lung cancer. When it comes to small cell lung cancer, people with localized disease, that is disease that is still within the lung, have 64% survival rate. Now, when it's regional, when I say regional, that means it has spread to like surrounding lymph nodes, survival drops to 28%. Check this out. If it has spread to other parts of the body, let's say to the liver, to the kidneys, to the brain, you name it, survival drops to 8%. 8%. So it is vital that we identify cancer very early. And you know, almost every cancer, even the ones that are most difficult to treat, if you discover them early, you can be cured. You can be well treated, managed, cured. You can be in remission for a long, long time. So it's very important to find it early. Now, cancer survival is also type dependent. And another illustration for this is, when you take testicular cancer, for instance, 98% of people who have testicular cancer can survive it. But when it comes to pancreatic cancer, which we know is difficult to treat, 1% can survive it. And that's because most of the time, pancreatic cancers are identified late. They don't have symptoms like other cancers do. So they are usually identified late, and you have survival rates of 1%. So just pay attention to what I have just said. More than 80% of people who are diagnosed with cancer types which are easier to treat can survive cancer. while 20% of those diagnosed with difficult cancers will survive it. So there is a huge difference. It's very important then that we pay attention to our body. So let me make transition to how do we ensure survival from cancer? I'm going to go over just some things, okay, that we all need to be aware of. Number one is for us to get educated. Be aware. Not knowing is not an excuse, because there is information out there on the internet. There are different days in this country are earmarked for different cancers, and there are programs on TV talking to you about cancers. We have health fairs, not just ACCI, but there are various organizations that are devoted to particular cancers. So information is out there. It's our responsibility to seek that information. Or when people bring it to you, listen to them and get educated, because knowledge is power. Secondly, be aware of your body. If you are aware of your body, you can tell when something is different, okay? If you examine your breast, be it male or female, okay, because anybody can have breast cancer, be it male or female, if you know what your breast feels like and looks like, if something changes, you will notice. And then you can go to your doctor and say something. But if you don't know what you feel like, you don't even know what you look like, how are you going to tell that something is different? Next is do not procrastinate. You saw a doctor, they did an exam, he said, oh, I found a lump, and he gives you a prescription to go for mammogram. Don't put it off. Go get the mammogram. Or you had GI complaints, and your doctor does a rectal, he finds blood, or he feels something on your prostate, and he says he needs more workup. Don't go home and sit back. Go get whatever he has ordered, follow up. So do not procrastinate. Do the right thing. What do I mean by do the right thing? Following appropriate recommendations, seek second opinion if you're not sure. If you're in doubt, seek second opinion. Nothing wrong with it. Insurances will pay. They're not going to deny you. Go get a second opinion. Then seek support from other cancer patients. Now, ensuring survival from cancer. Things you must do once you have a diagnosis of cancer. Of course, you will go through fear. We are all human. You'll be scared to death. You'll be angry, why me? You'll be confused. You can even be in denial. These are all stages of grieving that you will go through. And eventually you will accept. And then you need to follow your appointments. When you're going on those early appointments, be sure to take somebody who you trust and who cares about you with you. Because you know, in all that confusion and fear, you don't hear more than half of what the doctor is saying. But the person beside you can take notes, can ask questions. Even if you don't remember questions to ask them, you can always call back or make another appointment, come back and ask those questions. But you need somebody who is going to record and pay attention to what is being said. Cry if you need to cry. You're human, it hurts. It also heals the heart, because if you don't cry, the pain itself can put a lot of stress on you. So cry, but don't cry forever. Be proactive, sit up and go do what needs to be done. Be sure your close relatives are aware of what is going on. You need to, if you need for a second ear to hear and assimilate, do that. Have a second person, like I said, to do the right things. Write any questions you may have. Keep all your appointments and follow through any tests, whatever test that has been ordered. Say you may need staging tests, you may need biopsy, all that. Go through with all that, okay? Very important to keep all your appointments. Follow your schedule. Report, if you start treatment, report all side effects promptly, because managing those side effects ensures that you keep your treatment schedule. And remember that all these treatments have been developed Okay, they are developed to ensure that maybe every 3 weeks is the best, gives the best outcome, or every 2 weeks. And as long as you can keep your side effects under control, you can keep the schedule and you can get better outcome. So also very important, drink a lot of fluid, a lot of water. Flush your kidneys and your liver. Those two organs are very vital. So you need to drink a lot of water to decrease the toxicity of any treatment you're going to get, okay? Because when those organs are impacted by any treatment, it reduces your chances of getting further treatment. Something like grapefruit impacts absorption of drugs, especially treatments that are oral. So stay away from grape juice. There's so many other juice that you can drink. Eat lots of fruit and vegetables. Eat animal products in moderation. I'm not saying don't eat any because you need protein, but eat them in moderation. Exercise, exercise, exercise. I cannot overstress that. I mean, exercise is good for every health condition, any illness. If you exercise, it helps. When it comes to cancer, body treatment, diagnosis, you name it, exercise, exercise, exercise. I can't overstress this. Live your life. Don't let the cancer live your life for you. You're going to keep all these appointments, but make time to have fun, to enjoy the things of life that you normally enjoy. Okay? You like going to a movie? Go to a movie. Watch a happy one. You like to take a vacation? Take a vacation. Don't put all of them off. Just walk with your doctor. Let him know you want to go on a vacation. They can walk around things and you can take a trip. Now, above all, be sure to continue praying and have faith. Do not let your guards down once you complete treatment and you're told you're in remission. That doesn't mean you just go to bed and sleep. There are things that you have to do when you're in remission to make sure you remain in remission, and that if something happens or changes, that you catch it early. Ms. Hai-Hong will go into that once I'm done with the things I'm talking about. Now, if you have follow-ups when you're in remission, keep up with all those. Remember that once you're done with treatment, people lose a lot of hair, their hair does grow back. So don't worry too much about it when you're going through treatment, because they will come back. And you know what? When it comes back, a lot of times the texture is even better. It looks nicer and looks well-groomed, easier to manage. Your nails, which has changed color, will gradually over time come back to normal. If you had neuropathy, they will resolve. Appetite has decreased, it will get back. Your blood cells have, been impacted. Over time, all those things will get better. So don't worry too much about it. Now, there's also the emotional part of being a survivor. Express your feelings. Look for positives. Don't blame yourself because you didn't do anything. Cancer can happen to anybody. Doesn't even matter if you have a family history. Those who don't have a family history, one day one of you becomes a family history. Nobody has had it and one person pops up. Something happened genetically. You become exposed to the environment or something triggers a genetic predisposition and cancer occurs. So don't blame yourself. Don't try to be upbeat if you don't feel like it. Be upbeat when you feel like doing that. You choose when you want to talk about your cancer. Find ways to help you relax. Stress is a no-no, okay? Generally, stress is a no-no. So be sure you get adequate sleep. Relax as much as you can. Once again, live your life. Now, at this point, I'm going to introduce our very own Ms. Hai-Hong Kai. She has spoken and recorded a lot of cancers on behalf of ACCI. So today, she's going to talk to you furthermore about cancer survivorship.
Hi, my name is Hai-Hong Kai. I'm a nurse practitioner from MD Anderson Cancer Center. I have been with MD Anderson since 2014, and right now as a medical oncologist side. My topic today is what to expect after treatment. Survivorship focuses on the health and the well-being of a person with cancer post-curative intent treatment. So completion of the treatment is the start of a new life. It brings hope and happiness. We want to have a healthy life. We want to do a new thing, and we want to adapt it to our new life. However, recovery could be lengthy, could be both physically and emotionally. And we also start to worry about our cancer could come back. We worry about the relationship. We also worry about the financial situation. Side effects from treatment may also be lingering, like fatigue, weakness, neuropathy. And we also start to worry and fear that the cancer can come back. Once we finish the treatment, your physician will develop a personal follow-up care plan, which will include regular physical examination and medical tests. This plan is based on your diagnosis, your treatment, and the toxicity during the treatment, and also your preference. Your treating physician will continue to manage the adverse events from your treatment, such as the fatigue, neuropathy, hypothyroidism. They will also detect a potential recurrence or potential second and primary cancer. Active participation in follow-up care is very important. It gives the patients a sense of control as we transition back to our daily lives. Keep your follow-up schedule is essential for maintaining physical and emotional health. As I mentioned before, follow-up schedule depends on the diagnosis. Some diagnoses will need routine lab and images, such as lung cancer, esophageal cancer. Usually, the images will need to be every 3 months plus the laboratory. Some diagnosis does not need any images or lab, but the patient will be seen every 6 months or so with a physical examination, such as a breast diagnosis. We usually will have to continue to have a routine mammogram plus or minus ultrasound. We may also need to do a bone density scan for a patient who has breast cancer on hormone treatment. Some of the diagnoses may need only labs, and some may also need the procedures as part of the surveillance. Those are the diagnoses such as colon cancer, gastric cancer, esophageal cancer. So follow-up is necessary to monitor for recurrence. During the routine follow-up, the physician will also manage the long-term toxicities. Most of the patients will have some certain degrees of side effects from the treatment, and it is an ongoing process. Some side effects lingers, sometimes could be years after completion of the radiation, and side effects could be both emotional and physical. Most common side effects for the long-term toxicities are fatigue, neuropathy, concentration issues, dysphagia and dry mouth from the radiation, bowel and bladder control, and lymphedema after the surgery. Psychological changes could also be present, such as depression, anxiety, worry about the cancer recurrence. It might be necessary to change daily routine to accommodate all the changes we had after the treatment. Once treatment is over, people who have had a cancer also want to know what they can do to stay healthy. It is important to realize that people who have had a cancer in the past can also have other health problems. We need to continue to follow your primary care physician, your cardiologist for all those health issues. Some may even also develop other cancers. Therefore, cancer screening is also important. Learn about the things you can do to help yourself to stay healthy once the cancer treatment is complete is very important. We need to continue cancer screening, such as a continued mammogram, colonoscopy, as recommended by Cancer Society. We also want to have a healthy living style. We need to stay away from tobacco, get moving, eat healthy, and get and get to and stay at healthy weight. The exercise. Exercise 150 minutes a week, such as 30 minutes every day. This could be anything you like walking, yoga, swimming. But if you cannot do 150 minutes a week, we could start with 5 minutes a day. Then we gradually increase until you meet our goal. So be active, exercise. Our goal will be 150 minutes a week. A healthy diet is a balanced diet. When we look at the plate, 1/2 of the plate should be vegetable and fruit, 1/4 should be protein, and 1/4 to be whole grain. Stop smoking and eliminate alcohol consumption. Follow-up is one way to find the recurrence earlier. However, follow-up will not prevent the recurrence. We need to know what are the signs and symptoms to watch for. We need to report new symptoms such as the pain, confusion, bleeding, and others. Some patients may ask, is there any blood test to see if there is any residual cancer? However, there is no test approved by the FDA for now to check the residual cancer. There has been a test called ctDNA, which has been used recently to check the residual cancer. However, this has not been approved by the FDA without clinical indication. So it's important that we have a routine follow-up, follow your physician to manage the side effects, be active and eat healthy. And this is very important as a survivorship. Have a good sleep and enjoy the life. I think this is the most important. We don't need to worry about all the cancer come back. If we follow all the indications, follow the physician, and continue the cancer screening, and we will have a much reduced chance of to have a secondary malignancy and also find the recurrence earlier to get the treatment again. And hope this will give you some insight of what's to happening after the treatment is over.
Okay, something that Ms. Kai said that I want to reinforce is the fact that if you are a cancer survivor, you've undergone one type of cancer treatment and you're now in remission, it's possible to develop a second primary. That means another kind of cancer. Okay, so when they're looking at risk factors for cancer, they will ask you if you've had a prior cancer treatment. That's why you might find someone who has had 3 cancers. Today, I'm aware of a 90-something-year-old man who survived prostate cancer, survived melanoma, survived colon cancer, and is still waxing strong. So once he was treated for his melanoma, he continued with his screening. As soon as he developed prostate cancer, they caught it on time, they treated him, he's doing fantastic. And then he kept up with his colonoscopy, with his routine screening, and colon cancer was also identified early, and he was treated, and he's in his 90s. And he's in leadership. Can you imagine? He's still very active, okay? So it can be done. The fact that, yes, he may predispose you to another thing. You may have lymphoma, finish treatment. 5 years down the line, you may end up in leukemia. You just don't know. And then, but cancer treatment has come a long way. The leukemia can also be managed. So these things can happen. If you had radiation for one form of cancer or the other, depending on one area, you may, and let's say you had radiation for breast, you may end up with lung cancer. I mean, those things can happen. Even regular drugs that we take for diabetes or something, rheumatoid arthritis, any of those can predispose you to a cancer. So very important, don't ever forget about undergoing those routine screening, especially for those cancers in which screening modalities have been established to make a world of difference. People take advantage of it. We are in a country where those things are available. There are countries that do not have any of this, and they can't do anything about it. So let's make a difference in our life. Thank you all very much. Looking forward to another edition coming up in July of it. Our topic, the topic will be a different cancer, possibly childhood cancer, prostate cancer. So we'll see you guys in July. Thank you all and have a good day. And Ms. Kai, thank you once again for the wonderful, wonderful job you're doing for ACCI. You're highly appreciated. Thank you. Okay. I don't know. How did we do? So, hello. Hi, Hong.
Oh, yeah.
Okay. How did we do?
I think it's great. What do you think?
I think, well, your husband will be the one editing it. So I'm gonna send it to he can upload it like he usually does, okay? I'm going to email him 3 other presentations and I'll tell him, no, he will put them on YouTube. One of them the childhood cancer, I wanted to do something, but she has already recorded it. I don't know how he can put it together, but that's for July. So we have time. I can still put something together and then give them, the 2 of them to him, and then maybe he can do something with it. But if he can't, let him just post it, like post the other lady's presentation. So tell him I say thank you very much. He's now a champion for ACCI, whether he knows it or not.
I will let him know. So he will expect 2 emails from you about the 2 videotape, right?
Yes, 3.
From
2 from one person. Huh?
1 from today and 2 from the other person.
No, I have 3 from 2 people. One is cancer prevention generally. The other one is childhood cancer. And then one is on prostate. So once they're all on YouTube, then we can post them on the different months where they're supposed to go. Yeah.
So you want him to put on the YouTube just like the last time?
Yes.
Okay. I will let him know.
Okay. Thank you so much. Okay. Have a good night.
All right.
Don't work too hard. Don't work too hard.
Bye. Bye, Kira.
Okay. Bye-bye.
Bye.